A favourite FRCA primary exam, testing your understanding of physics of how vapours work, is to ask you what you would do with your vaporizer if you were to hypothetically anaesthetise someone halfway up a mountain where atmospheric pressure is half of that of sea level. And the answer is exactly the same as you would normally. You don't have to change anything, and I'll go through why. Here's your simple plenum vaporizer, and we're going to use sevoflurane as an example, but it works for any agent. A vaporizer is a very simple concept in a complex piece of machinery, and essentially all it does is make sure any fresh gas passing through the vaporizer leaves fully saturated with sevoflurane. This means any fresh gas leaving the vaporizer itself has approximately 21 to 23 kilopascals of sevoflurane. This is the saturated vapor pressure, and this will change with temperature. So this number will depend on what temperature your room temperature is, but at about 20 to 25 degrees Celsius, that's your saturated vapor pressure of sevoflurane. Now clearly this is a ridiculously high number when you think about the fact that we only want about 2% sevoflurane actually reaching our patient. If we gave them this much, that's way too much anesthesia. So what happens is we blend it back in with our bypass channel. This is fresh gas that has bypassed the vaporizer, and it dilutes this fully saturated gas down into a more sensible mixture, which is usually sat at around 2%, depending on what flows we're using, etc. And that's where our control dial comes in. This control dial adjusts how much gas passes through our vaporizer and how much bypasses it. So if you adjust it so that more of your fresh gas flow is going to pass through the vaporizer, you're going to end up with a higher concentration because a greater proportion will be fully saturated and therefore less dilution will occur. On the other hand, if you have this at a low setting, most of the gas will bypass, only a tiny bit goes through the vaporizer and gets saturated with sevoflurane, and you end up with a much lower concentration. And this dial is calibrated to sevoflurane. That's why each vaporizer is only to be used with a specific vapor agent, because they are calibrated to the characteristics of that agent only. So this vaporizer is set and it gives off the saturated vapor pressure, and the dial is calibrated so that your end concentration is controllable. So at this setting there will be a 2 on the dial, and if you put the dial on 2, it means this final dilution will be 2% sevoflurane. And this is where the confusion comes in, and the most important thing is to think what units you're using. We're used to thinking of concentrations for liquid and solid drugs and percentage concentrations, but for vapors and gases it's a little different. What's actually important is the pressure that the vapor is exerting, so the kilopascals of sevoflurane. The reason we say it's 2% is because atmospheric pressure is about 101 kilopascals, and we are putting 2 kilopascals of sevoflurane in. So that is, as a percentage, about 2%. But what actually matters is that the patient is getting 2 kilopascals of sevoflurane. That's what's having the effect. It doesn't matter what percentage it is of the overall pressure. What matters is they're getting 2 kilopascals. So if we go up Everest, where our pressure is much, much lower, if we set our vaporizer to 2, it's still going to mean that there are 2 kilopascals of sevoflurane in our final dilution, but atmospheric pressure is half, about 50 kilopascals. So our concentration is now 4%, even though we've done nothing with our vaporizer, because we're getting the same number of kilopascals coming through, but expressed as a percentage of atmospheric pressure, you've got twice as much as you had before. But even though it is now a 4% sevoflurane mixture, you still only have 2 kilopascals of sevoflurane in the mixture. So you still have the same amount of anesthetic effect. So it doesn't matter what the atmospheric pressure is or your altitude. What matters is the kilopascals of sevoflurane that you are delivering to the patient. That's where the confusion comes. People think, oh, my vaporizer is giving double the concentration, so it must have double the effect. It's not. It's giving the same effect because it's still giving out 2 kilopascals of sevoflurane. The thing that will have an effect is temperature, because if your vaporizer gets very, very cold, then the saturated vapor pressure of sevoflurane will drop. And as you go up Everest, even if you've got a fabulous vaporizer that compensates for temperature brilliantly, there will become a point at which it's so cold outside it can't compensate effectively. The vapor pressure will drop and you won't be giving enough sevoflurane. So for exam purposes, they are testing your knowledge of this, whether you appreciate the difference between the kilopascals of sevoflurane and the percentage concentration. What matters is the kilopascals. The concentration is just a byproduct of the maths. It doesn't really matter what the concentration is. What matters is the kilopascals. In reality, the temperature outside is going to screw up your thermodynamics and your physical properties of vapors so much. You should really question why you're trying to anesthetize someone outside on Everest rather than getting them down to a safe altitude.